Congratulations on your pregnancy and the upcoming birth of your child. The following video aims to help you learn breathing and relaxation skills for labour.
There are 3 stages of labour. The first stage of labour begins with the latent phase. The cervix dilates up to 4 centimetres. Mild contractions will begin. These can be painful but are short-lasting, irregular and are not always continuous. This phase can last for many hours or even days, so it's important to stay at home where you can relax, rest, take warm baths and mobilise as and when you wish. Paracetamol can also help ease your discomfort. The active first stage of labour begins when the cervix dilates from 4 to 10 centimetres. Strong, regular contractions will begin, at least 2 to 3 in every 10 minutes. The second stage of labour begins when the cervix is 10 centimetres or fully dilated. Contractions become expulsive and you may experience an urge to push. This stage is much shorter, although requires more physical effort. There are several signs your labour has started. You may have a show, a blood-tinged mucousy plug. Your waters may break. This can be a slow trickle or a large gush of clear fluid. Regular strong contractions can start. Please contact maternity triage if your waters break, you experience any bleeding. Otherwise, you can remain at home until your contractions are strong and regular. If in any doubt, phone for advice.
In the first stage of labour, a common response to pain is the fight or flight response. This will cause an increase in your heart rate, your respiratory rate and your blood pressure, which will in turn cause an increase in cortisol production. Cortisol is a stress hormone and it will increase your perception of pain. In short, the more stressed out you are, the more pain you will feel. Breathing and relaxation is a skill that you can learn to help manage this.
In early first stage or latent stage of labour, midwives encourage movement. During contractions or even when you're resting, you may want to adopt a position where you are upright and leaning forward so that gravity will encourage your labour to progress. For example, standing, sitting or supported kneeling. Please now pause the video and find a convenient, comfortable position to practice breathing and relaxation. You can copy our model or pick your own. Just remember to be upright and forwards. Ready? Let's begin. Tune into your breathing, let it become slow, easy and relaxed. Allow your jaw, shoulders and hands to slacken. Think of contractions as waves. The pain will build, peak and then ease. When the contraction starts, give a long sigh out and keep relaxed with normal, easy breathing throughout the contraction, focusing on your out breath. At the end of your contraction, always end with a long sigh out. Try that again in a different position. Please pause the video and choose another position. You can copy our model or pick your own. Just remember to be upright and leaning forwards. Ready? Let's begin. Tune into your breathing. Let it become low, easy and relaxed. Allow your jaw, shoulders and hands to slacken. Think of contractions as waves. The pain will build, peak and then ease. When the contraction starts, give a long sigh out. Keep relaxed with normal, easy breathing throughout the contraction, focusing on your out breath. At the end of your contraction, try to end with a long sigh out.
Between your contractions in early labour, you may choose to get up and walk around. In the later stages, you may choose to rest. Either is fine. Partners, you can help by massaging the lower back, offering encouragement and reassurance, and between contractions, suggesting different positions and offering sips of water.
Now let's try that again in a different position. Please pause the video and choose a position where you can copy our model or pick your own. Just remember to be upright and leaning forwards. Ready? Let's begin. Tune into your breathing. Let it become low, easy and relaxed. Allow your jaw, shoulders and hands to slacken. When the contraction starts, give a long sigh out. Keep relaxed with normal, easy breathing and concentrate on the out breath. As the contraction builds up, breathing alters, becomes faster and shallower. If you feel you're about to tense up, especially at the peak of your contraction, try blowing out slowly. Return to the nice, gentle, easy breathing. And end with a long sigh out.
Sometimes prior to full dilatation, you may experience a premature urge to push. This can be detrimental, so blowing or changing position can help lessen this urge. It's important you listen to your midwife carefully. She can help guide you.
Once you are fully dilated, you can begin pushing your baby out. Your midwife will guide you in pushing with your contractions and will usually be happy for you to adopt the position of your choice. When you feel the normal desire to push, you should work with this feeling. Breathe gently in as the contraction starts, and when the urge overwhelms you, tuck your chin in and bear down towards your bottom, keeping your pelvic floor relaxed and letting your breath escape gently through your lips. As your baby's head is about to emerge, work with your midwife to control the speed of delivery by alternating, pushing and blowing. During the third stage, the placenta has to be delivered. You may be asked to help by pushing.